Today we will be discussing second-generation antipsychotics and the treatment of schizophrenia. Schizophrenia is a mental illness that is characterized by distortions in thinking, perceptions, emotion, language, sense of self, and behavior. The debilitating disorder affects more than 23 million people worldwide and is more common among males than females. The psychosis can be classified into positive and negative symptoms. A person is subjected to positive symptoms including delusions, hallucinations, bizarre behavior, disorganized thinking, and speech. Negative symptoms are inclusive of lack of motivation and emotion, poor self-care, reduced speech, and anhedonia, which is the inability to feel pleasure in normally pleasurable activities. Schizophrenia is thought to be due to subtle changes in an individual's brain maturation and development. It is believed that schizophrenia could be a result of excessive activity of dopamine, which is a neurotransmitter present in the body that sends signals of reward and motivation to other cells. So how is schizophrenia treated? Antipsychotics have been introduced for the treatment of schizophrenia. First-generation or typical antipsychotic drugs were ineffective in up to one-third of schizophrenic patients and created unwanted side effects which included tremor and tardive dyskinesia, which is involuntary movements in the face and body. This led to the production of second-generation antipsychotic drugs. A second-generation antipsychotic that will be discussed in this video is clozapine. Clozapine was approved by the FDA in 1989 as an effective second-generation antipsychotic for people with treatment-resistant schizophrenia. Clozapine can be taken orally. The drug is able to effectively block D2 and D4 dopamine receptors in the mesolimbic pathway, known as the reward pathway in the brain. Current research determined that blockage of these receptors by clozapine aims to reduce the positive symptoms of schizophrenia. Antipsychotic drugs may also subsequently block D2 receptors in other pathways, such as the mesocortical system, tuberoinfundibular pathway, and nigrostriatal pathway, as they are non-specific to one route. Side effects of clozapine include lowered white blood cell count, seizures, inflammation of the heart muscle, decrease in heart function, and potential heart failure. These side effects, therefore, require weekly blood monitoring.
In 2012, a meta-analysis conducted by the Primary Care Companion CNS Disorders discussed the safety and tolerability of the short and long-term use of antipsychotics. It concluded that first-generation antipsychotics expressed extrapyramidal side effects that were often intolerable. This led to the development of second-generation antipsychotics, which have less side effects, however express concerns of metabolic issues such as weight gain. Within this meta-analysis, a study by Katie compares the effectiveness of second-generation antipsychotics through a double-blind randomized clinical trial. This included a large adult sample that was randomly assigned to receive different second-generation drugs over an 18-month time period. The study found that during the second half of the trial, clozapine was significantly more effective than other second-generation antipsychotics. Concerns in the quality of this study include the fact that there was no placebo, which affected its validity and potential bias. Along with this, the requirement of weekly blood draws created issues regarding patient compliance. Despite this, the study was still a success, as it provided information which now allows doctors to choose the most appropriate medication according to the patient's individual needs. Haloperidol is a comparable first-generation antipsychotic drug that was first trialled in the 60s. It is still prescribed to patients today, however is an unpopular treatment choice due to the high rates of extrapyramidal side effects, such as tremors, that often makes the drug intolerable. Overall, the introduction of second-generation antipsychotics, including clozapine, has had a positive impact on social aspects of a patient's lifestyle. Its introduction has resulted in a radical reduction in disability through minimization of positive and negative symptoms of schizophrenia, leading to a more conventional lifestyle. In saying this, there are issues regarding patient compliance and hence, tracking drug consumption and effectiveness of treatment can prove difficult. Second-generation antipsychotics, including clozapine, have also had an important clinical impact. They have introduced advanced treatment which seeks a reduction in side effects inflicted on patients, especially those with treatment-resistant schizophrenia. Constant developments in research and clinical trialling of antipsychotic treatment leads to an ever-evolving field of pharmacology, with research ensuring the tackling of challenges that come with the complexity of schizophrenia disorder.